The easing of COVID-19 restrictions by the president has attracted some positive reactions from the general public. Though many are still skeptical about the decision, the Ghana Medical Association and some allied health service providers, business community and travelers in and out of the country have welcomed the new measures with lots of relief. We'll share their thoughts with you soon, but first let's bring back President Akufo-Addo's announcement indicating the details of the various restrictions and their respective review. He charged all and sundry to live responsibly.
To my fellow Ghanaians who have not received the jab, I urge you to take it. To those listening to the propaganda by the conspiracy theorists, and those who are still skeptical about the efficacy of the vaccine, it has been a year since my wife and I got vaccinated. It has not disrupted our physical well-being. Neither has it caused us to be sick. We are, touch wood, hale and hearty, like the other 13.1 million Ghanaians who have been vaccinated. With countries in the ECOWAS community, especially in our neighboring countries, presently like us, recording very low levels of infections, and having significant numbers of our people vaccinated, and on the advice of the National COVID-19 Task Force and the health experts, I've taken the decision to revise the COVID-19 restrictions enacted under EI 64. At this point, I want to express the great gratitude of the nation to the leadership and membership of the Ghana Health Service, to all other health workers, and to members of the National COVID-19 Task Force for the outstanding work they have done in bringing us this far. Ours has been an all-inclusive national effort, including the security services, public and private sector agencies, religious and chieftaincy institutions, charitable organizations, all of whom have helped in bringing us this far. I hope I'll be forgiven if I single out the Church of Pentecost, the Catholic Church, and the COVID-19 Private Sector Fund for special praise. They all demonstrated exceptional love of country. So, from tomorrow, Monday, 28th March, the wearing of face masks is no longer mandatory. I encourage all of you, though, to continue to maintain enhanced hand hygiene practices and avoid overcrowded gatherings. All in-person activities, such as those that take place in churches, mosques, conferences, workshops, private parties and events, cinemas and theaters, may resume at full capacity as long as the audience and all participants are fully vaccinated. Hand washing and hand sanitizing points should be made available at these venues. Outdoor functions at sporting events, entertainment spots, political rallies and funerals may resume at full capacity, again, as long as all persons at those events are fully vaccinated. Government will continue to engage all religious and traditional leaders, agencies and institutions to encourage their congregants, subjects and citizens respectfully, to be vaccinated to help achieve the 20 million target by June 2022. I'll also urge the media to support this campaign in full. Fellow Ghanaians, we had to impose measures to limit the importation of the virus into our country, especially as our first cases of the virus were imported through the Kotoka International Airport, KIA. Currently, the Kotoka International Airport only allows fully vaccinated passengers who are in possession of a 72-hour negative PCR test result prior to embarkation and have a negative antigen test on arrival in the country. Are given by the Ghana Health Service to allow them entry into the country through the Kotoka International Airport. They must also have a 72-hour negative PCR test result prior to embarkation, take an antigen test on arrival, and are offered vaccination. From tomorrow, Monday, 28th March, fully vaccinated travelers into Ghana will not take PCR tests from the country of embarkation to allow them entry into the country through the KIA, and will not be tested on arrival. Citizens and foreign residents in Ghana who are not fully vaccinated would, however, need to provide a negative PCR test result of not more than 48 hours. They will undergo an antigen test upon arrival at KIA and will be offered vaccination there. Ghana's foreign missions have been instructed to make vaccination a requirement for visa acquisition. It is worth noting that the establishment of the COVID-19 testing infrastructure at the Kotoka International Airport by Frontier Healthcare Services Limited at its own cost has been key to our ability to limit successfully the importation of the virus into Ghana through the airport. The efficacy of the testing regime at KIA has won global admiration and has been applauded by all those who have undergone its testing. It has been one of the reasons why Ghana was not at the receiving end of several of the travel bans imposed by the West at the height of the pandemic, for which many African countries were affected. As from tomorrow, Monday, the 28th March, all land and sea borders will be opened. Fully vaccinated travelers will be allowed entry through the land and sea borders without a negative PCR test result from the country of origin. Citizens and foreign residents in Ghana who are not fully vaccinated will have to produce a negative 48-hour PCR test result and will be offered vaccination on arrival. Fellow Ghanaians, it has been a difficult 2 years for all of us, and we're seeing light at the end of a very long tunnel. I appeal to all of you to live responsibly, protect yourselves at all times, and do everything we can to stay safe.
That was President Akufo-Addo announcing that those new measures